Hello, YouTubers. Welcome to my channel, Lady Nephrology, where we talk all things nephrology. If you know any ladies in particular or anyone who is living with chronic kidney disease, end-stage renal disease, or have a kidney transplant, please refer them to my channel, Lady Nephrology. Please like, comment, and subscribe, please. All right, so today's topic, we're going to be talking about lupus and kidney disease. And I'm dedicating this subject to a patient I took care of many years ago when I was living in Kansas City. Her name was LaTonya, and she had lupus, and it ended up developing into lupus nephritis. It attacked her kidneys, and she ended up on dialysis. And she had 4 children, and so she was dealing with being a mother, being on dialysis, and unfortunately, about a few years into her being on dialysis, she did pass away, and she did leave her 4 children without a mother. So this topic today is dedicated to LaTonya. Okay, so let's go ahead and get started. So we're going to be talking about lupus and kidney disease. And here's a reference here where I got the information from. So what is lupus nephritis? Lupus is an autoimmune disease, which is a disorder in which the body's immune system attacks the body's own cells and organs. Lupus nephritis is a type of kidney disease caused by SLE. Kidney disease caused by lupus may get worse over time and lead to kidney failure. So if your kidneys fail and you go into end-stage renal disease, you will need renal replacement therapy such as dialysis or a kidney transplant. So what causes lupus nephritis? So no one knows exactly what causes the disease. It could be a family history maybe, or things in the environment such as infections, viruses, toxic chemicals, or pollutants such as car fumes or factory smoke. Some of those things may play a role in causing the disease, but we're really a lot of times not completely sure. For the epidemiology, lupus is more common in women than men. Lupus most often strikes women during the childbearing years. 9 out of 10 people who have lupus are women, so it's more common in women. And lupus is more common in people of African or Asian background. African Americans and Asians are 2 to 3 times more likely to develop lupus than Caucasians. And in the United States, 1 out of every 250 African American women will develop lupus. And in adults with lupus, as many as 5 out of 10 will have kidney disease. So that's half, so that's pretty staggering. 5 out of 10 people who have lupus will end up with kidney disease. Some of the symptoms of lupus nephritis, a lot of times you might have foamy urine, proteinuria, which is protein in your urine, hematuria, which is blood in the urine, and edema. And edema is swelling that occurs when your body has too much fluid. And it usually, the swelling occurs in your legs, feet, or ankles. And weight gain is also another symptom. And a lot of people end up developing high blood pressure. Some of the symptoms include joint pain or swelling, muscle pain, fever with an unknown cause. And a classic symptom is the red rash on your face, which spreads across your nose and your cheeks. And they sometimes call that the butterfly rash. So how do you diagnose lupus nephritis? Usually we check the urine, check for any blood or protein in the urine. And then we do blood tests, and that will check for your kidney function. And I'm also checking for creatinine, which is a waste product from normal breakdown of muscles in your body. And your kidneys remove the extra creatinine from your blood. So that's what we usually check to diagnose. Or also, one of the last thing or most invasive things is doing a kidney biopsy, which is a procedure that involves taking a small piece of kidney tissue for examination. They look under a microscope, and then that can confirm the diagnosis of lupus nephritis. And the treatment of lupus nephritis, you want to have medications that suppress the immune system, so it stops attacking and damaging your kidneys. So the goals of treatment for lupus nephritis, you want to make sure you reduce the inflammation in your kidneys. You want to decrease the immune system activity and block your body's immune cells from attacking the kidneys directly. So a lot of the medication they use is prednisone, mycophenolate, hydrochloroquine. Those are some of the medications that they use to suppress the immune system and reduce inflammation. And if a person with lupus nephritis develops high blood pressure, they can start them on an ACE inhibitor, which is like a lisinopril, etc. ARB, which is losartan, is another blood pressure medication, diuretics, beta blockers, or calcium channel blockers. And also diet changes help with lupus, especially reducing the sodium in your diet. So some of the complications of lupus can include permanent kidney damage. The most serious type of lupus nephritis is proliferative nephritis, which can cause scars to form in the kidneys. The scars damage the kidneys and keep them from working properly. As kidney damage worsens, it can lead, like I said earlier, to kidney failure or end-stage renal disease where you'll need dialysis or a kidney transplant for survival. People with lupus nephritis have a higher chance of getting certain type of cancers. A lot of them develop heart problems and blood vessel problems. So if you're a person and you are diagnosed with lupus nephritis, make sure that you are following up closely with your nephrologist and a rheumatologist for the proper treatment plan. All right, guys, thank you so much for listening. That's just a little bit about lupus nephritis. And really, my channel is about women, and the lupus nephritis does affect more women than men. So it's just getting educated about that, about lupus. Like I said, if you have lupus, make sure that you're following closely with your rheumatologist. And if you have lupus nephritis, make sure you follow up with your nephrologist. Thank you so much, guys. Please like, comment, and subscribe. Have a good day.